What is H5N1 avian influenza and its symptoms and how fatal it can be? The most common route of virus transmission for avian bird flu is direct contact. When a person comes in close contact with infected birds, either dead or alive. On July 21, an 11-year-old boy died of H5N1 avian influenza in Delhi. This is the first recorded death due to the bird flu in India this year. In January, bird flu was confirmed in several states with thousands of birds including migratory species being found dead. What is bird flu? Bird flu or avian influenza is a disease caused by avian influenza type A viruses found naturally in wild birds worldwide. The virus can infect domestic poultry including chickens, ducks, turkeys, and there have been reports of H5N1 infection among pigs, cats, and even tigers in Thailand zoos. Avian influenza type A viruses are classified based on two proteins on their surfaces, hemagglutinin HA and neuraminidase NA. There were about 18 HA subtypes and 11 NA subtypes. Several combinations of these two proteins are possible. Example, H5N1, H7N2, HNN6, H17N10, etc. Infection in humans. There have been reports of avian and swine influenza infection in humans including AH1N1, AH1N2, AH5N1, AH7N9. The first report of human H5N1 infection was in 1997 and currently over 700 human cases of Asian highly pathogenic Asian avian influenza H5N1 virus have been reported to the World Health Organization from 16 countries. The infection is deadly as it has high mortality rate of around 60%. The most common route of virus transmission is direct contact. When a person comes in close contact with infected birds, either dead or alive, humans can also be affected if they come in contact with contaminated surfaces or air near the infected poultry. There is no sufficient evidence suggesting the spread of the virus through properly cooked meat. Symptom of avian influenza. According to US CDC, the reported signs and symptoms of influenza A virus infections in humans have ranged from mild to severe influenza like illness, fever, cough, sore throat, muscle aches, nausea, abdominal pain, diarrhea, vomiting. Severe respiratory illness, example shortness of breath, difficulty breathing, pneumonia, acute respiratory distress, viral pneumonia, respiratory failure, neurologic changes, altered mental status, seizures. Risk groups: children and adults below 40 were seen to be the most affected and mortality was high in 10 to 19 years old. Human to human transmission. AIIMS chief Dr. Randeep Guleria told PTI that human to human transmission of the H5N1 virus was very rare and there was no need to panic. The transmission of the virus from birds to humans is rare and sustained human to human transmission of the H5N1 virus has not yet been established and therefore there is no need to panic. But then people working closely with poultry must take precautionary measures and maintain proper personal hygiene. A paper published in 2005 in the New England Journal of Medicine investigated possible person-to-person transmission in the family cluster in Thailand and wrote that the disease in the mother and aunt probably resulted from person-to-person transmission of this lethal avian influenza virus during unprotected exposure to the critically ill index patient. Dr. Neeraj Niskal, an associate professor in the Department of Medicine at AIIMS, told avian influenza or blood flu is predominantly a zoonosis and there is no evidence of sustained human to human transmission so far. Thank you.